Hey everyone, it's Dr. Rick, founder of Verbal 411, and I'm going to be giving you advice on what the value of a gait analysis is. And if you're one of my patients, you know that I always rely on physical therapy. Number one, because usually it's covered by insurance. Number two, they're the best coaches that I have that can identify obstacles to your getting better. Part of the healthy lifestyle change is always going to be what kind of nutrition do you practice? How is your sleep? Do you have a sense of purpose? Do you have a family and supportive structure? But also, do you exercise? And exercise can be in the form of resistance, it can be in the form of cardiovascular fitness, flexibility in yoga, or even breath exercise or hiking, nature therapy. But all these things are important and they're fine-tuned to your personal program. Now, everybody's a little different when it comes to walking style. Everybody definitely is different when it comes to running style, especially if you're going for speed or if you're just doing leisurely 5Ks or if you're practicing to finish a marathon. All those things require proper form. And I have not met the perfect person. And I'm not that because I have a whole bunch of injuries. But the issue would be identify your injuries and your obstacles, bolster them or reverse them, and then continue on with your lifestyle change. That way, there's no hitch. You don't flare up anything. You really enjoy the things that you're going to embark upon. Then you can get to the daisy chain where you do the introductory activity, you get really good at it, and then you graduate to a different activity. And in Chicago, it's going to be cold in about 4 months. And that's when we have to go indoors. And certainly you want to take advantage of the outdoor season as much as possible without an injury, but we also have to have the transition to indoors, which is a little bit different. But you'll learn when I interview Sean over at PT Solutions in Elgin about the value of having a baseline and having a physical therapist on your team in case that flares up or for more ideas. I can certainly be the head coach, but I need other coaches involved with the specialties of musculoskeletal medicine, specialties of nutrition, specialties of calming practice and psychology. All these things are important, but in here, our segment today, we'll talk about physical, we'll talk about movement, we'll talk about gait analysis, and hopefully have you understand what value you can get with a physical therapist on your team.
Hey Sean, thanks for allowing me to come and get the gait analysis. I value your opinion. Sean's over here at PT Solutions in Elgin. I don't know the address here, but...
We are at 400 South Randall Road.
Excellent. Right in front of the Target, next to the Circle K gas station. What I wanted to do is tell people that are beginning a walk to run program, or they're in a walking program / running program, and they're going to be going to maybe a 5K or for the most part training for a marathon. But what is the value of those gait analyses of the treadmill runs in the running stores?
So in my personal experience to get some running shoes done, I recall they just primarily looked at the feet. When it comes to running though, it's pretty much the entire lower body. So it's a little bit more than just putting on a pair of shoes and just going out and moving your feet quickly. It's how basically the ankle joint and hip joints all work together to basically get you going forward at faster durations.
Some of my patients would be apprehensive. I usually will get a little bit of pushback. I value physical therapy tremendously, and I know there might be a copay of some sort with insurance, but going to a physical therapist for a full body analysis, or at least a gait analysis, I think is crucial to prevent an injury, especially for beginning running, or even if you're advancing running but you're trying to build up speed. I see a lot of people with knee pain. I also see people with flat feet. I have that, but I think there's value in knowing how the foot strike is, what kind of shoes to wear, or identifying, okay, we have a knee issue. Is it because of the tracking of the knee, or is it because of excessive tightness to the hamstring? So what would be the best way to have a patient know what to expect when they come in for a gait analysis?
Well, see, that's kind of the nice thing about PT Solutions is we actually do free screenings. So if someone wanted to get their running form checked out, just come on in. It's like, hey, I want to get my running form checked out. Make sure that I'm not about to go out and do anything that might cause me pain later down the line. But even too, though, as well, PTs aren't just rehabilitative, but also prehabilitative. Like, we can work with you before an injury becomes a problem. And usually I would say those durations, if we get a hold of you before there's a problem, that time frame is a lot shorter than after there's a problem.
Right. Oh, that makes a lot of sense. So when I clear somebody for surgery, whether it's hip replacement, knee pain, or knee issues, I usually suggest do some prehab prior to the replacement of the knees or the orthopedic routine, because it does shorten the time of post-op healing. And just like trying to prevent an injury, if you can do prehabilitation, number one, if there is a knee issue from before, or pes plantar, or flat feet from before, or hip issues from before, it should be able to get covered by insurance if done right. But it's still valuable because it decreases the injuries if they come up, and it also speeds up the transition to proper running form, right?
Yes, fortunately there is research out there that shows that if we can do any type of muscle strengthening before surgery, it can help with the recovery process afterwards. So, therefore, even in that sense too, can hopefully decrease the duration that you will be here. And, kind of as you touched on with the copays, can decrease the number of copay visits we have to cover as well. So, again, with like a little bit of extra short-term prior surgery, we can hopefully minimize the longer durations afterwards, and get you back out living, good quality life sooner.
And truly enjoying the running thing.
Exactly.
Yeah, for beginners, or even people that have run before, but they gave it up for a while, or they run on a treadmill, they're going to be transitioning outside. I didn't know that you have a free screening. Do patients just call up, or?
Yes. So you can give us a phone call, or I think most of our clinic locations, or at least a few that I've been to, some of them will have the signs displayed, walk-ins welcome. So whether you want to drop on by on your way home from work, or give us a phone call and just be like, hey, I'd like to do a free screening. We usually do our best to get something set up right there in the moment, so that way it's not just kind of like you're stuck waiting for a while. Of course, it depends on how many patients any of the clinicians have during that hour, but we usually do our best to get that addressed right there in the moment, just because it's like, let's help you out. That's what we do.
Excellent. I'm assuming during that visit for gait analysis, you would have them come in with running clothes and their running shoes? Or?
Yeah, if they specifically want to have their running form looked at, it would be best if they came in with running shoes, the stuff that they're typically going to wear as they go out for runs. If they're coming for work, that can get a little bit trickier. But, I can at least kind of take a look at how they walk. If you were to look at the specific details of running form versus gait form, the only big difference is running has this float phase where both feet are off the ground. Otherwise, you could say, generally speaking, mechanics are similar. Either way, we could look at the walking. And again, if you're here specifically for running, come on in with some running shoes and running clothes, and we can take a look at things on the treadmill.
That float phase you were talking about, if people improve their form, float phases when you're not making contact with the ground, if you improve your form, technically you can also improve your times, right?
Yes.
For those that are going for a 5K?
Yes. So my brother is a track and cross country runner. Historically speaking, through middle school and high school, I was more of a swimmer myself, but between those two sports, you're racing against time and against other people. The foundation there is pretty much similar. You get the form down, you're going to see a decrease in your time, which means you're going faster to get to the finish line and hopefully get first place.
Got it.
Or get a PR, which is another first place winner in my book in a different sense.
Yeah, personal records are always attainable, and sometimes instead of competing with other people, just do a PR and then try to improve on yourself before end of the season. Hopefully end of the season this year will be October. We also have other things that we can do to transition to the inside, especially during wintertime, and then pop out for springtime 2027. So let's do a gait analysis.
Works for me.
Just walk me through what gait analysis would entail and what you look for.
So pretty much what would happen is you come in and tell me things like, hey, my walking feels off, or I want to get my walking checked out, running, things like that. What I would do first is pretty much just kind of look and see how things are going. So, if you and I are sitting down for either a free screening or an eval, and you tell me like, hey, my leg hurts whenever I walk or run or things like that, it's like, all right, let's take a look, see how things are moving. So what I would do at first, just kind of getting a number of steps in, is like looking at one side compared to the other. Does anything look off? And if I see something off, especially on the side of the body that you tell me that there's a problem, it's like, okay, let's zoom in over there. And I'm looking at everything from the ankle all the way up to the hips. So after I get done looking at things from directly behind, then I would come over here and look at things from the side. does everything still look even from that as well? Or again, is something off? We zoom in more on that and just be like, all right, what specifically is different here? So in the case of evaluating from the side of the patient, even though I'm standing behind Dr. Seguil right now, it would be another matter of, does everything look like the legs are moving in equal distance? Okay. Otherwise, do we have a shortened stride length on one side? And that shortened stride length can be because of a few different things. One problem in particular is maybe the hamstrings are too tight, and because of that tightness, it doesn't allow us to swing that leg as far forward as it needs to. Or maybe in some cases, we might have tight hip flexors on one side where the particular leg can't go all the way back, and in which case it shortens the stride length on the opposite side. So those are some things that you can see when you're watching from a lateral view, keeping in mind with the kinematic chain as well. Even though I'm talking about the lateral view, looking at things from behind too, I can also look to see if someone's foot is rotating inward too much like this. And because of this term we call the kinematic chain, which just a fancy way of saying everything's really interconnected, that extra rotation can kind of send a chain reaction up the leg to maybe even cause some extra working of low back muscles. So maybe sometimes those muscles will get over fatigued with a problem like that, and patients will start to experience back pain. And the thing is, that little problem could be solved by just a $15 orthotic instead of having to go in for some type of really expensive surgery.
With regards to, if you did see that, would you guys tape or do anything temporary here to see if it makes people feel better?
So yes, what we would do here basically is we have options like kinesio tape, see if we need to kind of help alleviate some tension on certain muscles, but then also just kind of making sure that we're working the tiny intrinsic muscles of the foot to help kind of give the body its own stability. Like yes, we can use extra tools like tape and orthotics and things like that to kind of help give support in the meantime. But it's also just really nice too that it's like your body's able to do this on its own. So yeah, we would work the tiny foot muscles, working our way up the leg, and just make sure that all the muscles are working, you know, in sync with one another and everything's balanced out the way it should be.
Excellent, Sean. So we've learned about the value of a gait analysis, learned about the value of, what you call it,
The kinematic chain.
Kinematic chain. Can you explain that a little further as far as how you're not only worried about lower here, but anything else up top?
Treating the person, not just the problem. Like I said with the kinematic chain, everything's really interconnected. Everyone's got this ability to basically be their own mechanic if you think about the human body being the biological equivalent of a car. Mm-hmm. But sometimes you run into problems that you just maybe don't have the skill set or the knowledge to be able to do this on your own and make your own repairs. In which case you can come to PT and you can think of us like the dealership or a mechanic shop. And we can either give you a tune-up to prevent further injuries getting worse, things like that, or in the case of something is being broken, it's like, all right, let's get this taken care of and get you back on the road, so to speak.
That's another thing to talk about is, if you're able to get somebody to get into a running routine, walk to run routine, or improve their time for 5K, half marathon, or marathon, if they get injured during that training, you can also take care of them and facilitate.
Yeah, healing through motion, I guess you could say, is we can kind of help facilitate people basically getting better a little bit faster.
Yeah, versus just getting off, putting your leg up and not doing anything at all, which is usually the default, I think. But then atrophy occurs within a week. I think it's a 20% loss of muscle mass within 1 week. And getting back to the running might be a problem. Not only do you have the injury, but you have weakness, whereas you guys can actively get them moving while not hurting their injury, right?
That is the goal. Not every injury, unfortunately, can be resolved through rest and ice.
And you also do modalities for those?
Yes, so modalities, there's a list of them. Depending on which clinic we're talking about would determine which ones are available, but some things like ice packs, heating pads, those are considered modalities. Even some type of soft tissue massage, using things like electrical stimulation. In all honesty, these things on their own will not resolve the problem. It's kind of more of a feel-good stuff, but we can use it in combination. Like if somebody comes through the door and like just everything's like really flared up, we can try to use that in the beginning of the treatment sessions. And just like, all right, let's get the pain to calm down.
Got it.
Okay. All right, now let's see what type of movement we can do, and that way it's like used in combination with strengthening, flexibility type of stuff, and just working joint mobility. It's like, all right, that's how we can kind of get things improving faster.
I highly suggest physical therapy for my runners, my beginning walkers, anybody. I think it's always important for injury assessment, it's definitely important for moving forward in your sport without getting injured later on too. So thanks for telling my patients and my viewers about what to do. Hopefully they can come out and see you. Can you give them the address?
Should be 400 South Randall Road, Elgin, Illinois.
Thanks for watching, and hopefully see you in the next YouTube video.